All right, thanks, Gil. Well, cancer is not taking a break in this pandemic, so getting the proper screenings is still important. And today we're talking about colon cancer and why it's so important to get the word out in the Black community. Joining us to talk about this is Chioma Anju, a board-certified gastroenterologist with Hartford Healthcare. Doctor, welcome.
Thank you for having me.
So in the wake of actor Chadwick Boseman's death at just 43, can you speak a little bit about colorectal or colon cancer?
Absolutely. Yes, the death of Chadwick was a great shock for many reasons, but namely because of his young age. However, colorectal cancer, or colon cancer, as we shorten it sometimes to refer to, is actually not that uncommon. It's the third most common cause of cancer among men and women in the United States, and it's actually the second most common cause of cancer-related death. I've heard many patients tell me, well, doctor, I don't have a family history. Do I need to be concerned? And most colon cancers are actually in people who do not have a family history.
Is it surprising that the actor developed colorectal cancer at such a young age?
Actually, several of the national gastroenterology societies have said for over 10 years that African Americans are more likely to develop colon cancer at younger ages. When they do develop it, it tends to be more aggressive, and they're more likely to die from it than their non-African American counterparts.
Doctor, talk about the signs and symptoms of colorectal or colon cancer.
Absolutely. So if you have signs like rectal bleeding, weight loss, change in your bowel patterns, those are things to let your doctor know about. Okay?
And let's talk about screening. At what age should screening begin?
That's a great question. So the U.S. Preventative Task Force suggests average risk individuals, so people without any family history, can begin at age 50. But in African Americans, for many of the reasons that I mentioned above already, 45 is the recommended age. If you have any questions, though, feel free to ask any of your healthcare providers and they can clarify it.
All right, let's talk about Hartford Healthcare. You're offering an upcoming webinar. Tell us the details.
Yes, so I'll be speaking on September 30th from 6:30 p.m. until 8 p.m. live about colon cancer in the African American community. There will be a live Q&A afterwards as well. So I look forward to seeing many of you there.
All right, Dr. Anju, thank you very much for sharing this important message. We appreciate your time.
Thank you for having me.
Thank you.